people. Yeah, so we wanted something that was going to be very useful, that we would be able to connect with you over a 12-month period. Because as seasons change, and there's like so many intrinsic things that affect the way our skin behaves, and lots of extrinsic things as well. So our hormones, whatever's going on inside our body, if we're stressed, and many things really, what we eat, what we drink, all of those things affect the way our skin looks on the outside. But there's also a lot of external factors as well, like the central heating, UV light, you know, everything that would change what we do and also what we put on our skin. And if you suffer with specific skin conditions, you know that you would become more sensitive if you're stressed, or if you put something on your skin and it's giving you a flare up. Especially people with acne, when they go in the sun, they immediately get an immediate, you know, result where it looks better, and then unfortunately a few weeks later, because the sun's damaged the surface of the skin, they'll build up more inflammation, and the skin barrier function gets affected. And everybody's skin changes. So as we age, and our hormones, and a lot of acnes are very androgenic and so on. So we wanted to look at something that was our baseline, that we could utilise for everybody, that wasn't going to cause a lot of inflammation within the skin and wasn't going to be too harsh. And where we need to be harsh, we can introduce other skin care, maybe prescriptive things, but have a base that is going to make a difference. And then if we have to step you up, we can step you up. If we have to step you down, we'll step you down. And that we can incorporate something else that might contribute and work in combination with what we've got here. So it's called ALLSKIN MED. And so it's somewhere in between. So it's definitely not a beauty treatment. It's not a harsh treatment that I maybe have to prescribe for somebody who's got something quite aggressive, but it is something in between, and it's all very science-based. There's some botanical in it which makes a difference, that's not too aggressive. So when we go on to prescriptive skincare, so for instance, if we're using direct retinoic acid, which is tretinoin, that has a real inflammatory effect on people's skin. So for instance, Sally, if you don't mind me saying this, or Val, when you've got sensitive skin, that's kind of when you've got some kind of rosacea or inflammatory changes that happens periodically, you can't have those kind of aggressive treatments. You need something, A, that's going to make a difference, but B, that isn't going to cause you to flare up and get more broken vessels, or you know, a change on the surface of the skin and affect the skin barrier function. So when that reacts, everything reacts with it. So we try to reduce the inflammatory response, but actually make small changes with building blocks that can actually make a bigger change in the future. And this is what this is going to do. So this is brand new to us anyway, but I think it's been around about, is that right? Of Aesthetic Source, did they launch it about a year ago? Sorry, Aesthetic Air, about a year ago. Can you hear me?
Yeah, it's quite new.
Yeah, yeah.
Yeah. So, which is good for us because we want to be there at you know, at the baseline. So it kind of has 4 different elements to it. So it's the prepare. So prepare your skin to accept different skincare with it, and to renew the skin cells, and to hydrate and to protect. So I think a lot of skincare companies base it on those kind of fundamentals. However, we do need to have something that's not going to be too aggressive. So what this has got is something that will exfoliate the skin, but use a botanical or use an anti-inflammatory, and use glycolics and citric acid, and what else have they got in here? I'm just having a little look what they've got, because I can't remember absolutely everything. So they've got citric acids in it, and lactics, but not too aggressive. So it takes longer. So quite often when we use something really aggressive on the skin, it'll have a massive effect, but it'll give you lots of downtime. Well, this is not going to give you any downtime. So we can start somebody on a sensitive skin on a basic retinol, which is a lower percentage. Them up. Quite often, people would reactively put them on something that's quite high percentage. But retinols are really good for also targeting acne and for regenerating the skin cells. So I'm really pleased that we've got these different steps. So we can start you on step 1, make sure we get a result, and then when that's finished, you know, you're happy with that, we can increase that as well to the next stage. And then over a period of year, we can pull things in and take things out, which is great. And what they've also got is some stem cells and growth factors, and they're particularly using in this skincare range. And it sounds a bit awful, but they're using snails, and I've used stem cells for quite a lot of years, and there's some pretty smelly ones, and these are not smelly at all, so you can't smell the stem cells at all, but they will help build, you know, will help the growth factors in the skin, build up the collagen and the elastin fibers, and help regenerate the skin growth and kind of wake up the lazy skin cells. So as you get to a certain age, you don't regenerate skin very easily, and actually we start to degenerate from about 25 years of age. So even if you're quite young, you'll have vulnerable areas on your face that maybe look a bit tired, and it doesn't mean because you're old, it's just that those are sluggish cells in those areas. So we need to kind of regenerate that, and we can do that using these kind of skin care regimes that we've got. So we can start off in the clinic and utilize the kind of care that we have here, a slightly different form, more on a professional level, and then you'll be able to, if you're happy with it, you can go home and use it, and then come back a couple of months later, and then we can monitor the changes to your skin, and we can pretty much guarantee, so we've seen some amazing things, which I'm going to show you in a minute, of changes over a period of time once you go on these skincare regimes, really. There's also what they're kind of signing up to and telling us to do, which I think we've always thought this is how we should do it. So, you know, people will go into a clinic and they'll have something quite extensive, and then they go home and they don't do anything again. They'll just go back to their own skincare. They won't maintain the stimulus that we've already created. And probably we're very guilty of that at Blemish Clinic. And I'm very much aware that that's what we probably have done. We've probably said, go away and do this, but we've not really followed it through. And what we're going to try and do is make sure that you do what we want you to do. And we'll incorporate in clinic light therapy and so on, which has been around for many, many years. And obviously that's my speciality, which is phototherapy. But we want you to do some things at home as well. So you might.
I think with sorry, Jan, I'm interrupting. Yeah. I think with this skincare range as well, we can in clinic we can say to you as a patient, oh, I think you should have this cleanser and this moisturizer, and you go away with it, and then, you know, months down the line, you'll come back and get the same products every time. Whereas with this one, you can mix it up. So your skin may need X, Y, and Z, and then you'll come back in a few months, we'll reassess your face and reassess your skin, and then we'll go, in fact, we're going to give you, you know, another X, Y, and Z, because we're done with that now.
Yeah, but we're not going,
you know, so we're not
to use lots and lots. Yeah,
we're not going to keep the roll ball. Yeah.
Thanks, Katie.
Sorry, Jan.
That was no. I want you to interrupt. That's great, because I can't remember everything. So it's great to have a chat and have it as more of a normal thing. So what people do is stick to the same thing. What I was trying to say before, we don't stick to the same shampoo, do we? So if you have the same shampoo and use that year on year, and you know that your hair changes, you know that your hair ages, and so does your skin. So there's no point in just sticking on to the same thing, but there's also no point as well in buying loads and loads of branded products and not really be 100% sure of what's happening to your skin when you're using them. So what we want to do is, get your use it, finish it, and then think, right, you did really well with that, but maybe let's step you up. Now, at the point, your skin changes, it becomes more sensitive, then we'll step you down and put you on another part of this treatment plan, really. So this will be kind of a 12-month process of looking at your skin, and we'll monitor you and take your photographs, look at the differences, and then make the choices based on the skincare that we've got. And if we need to introduce something that's a little bit more prescriptive and aggressive, then we will do, and then monitor you. And I've always done that with, say, prescriptive skincare, where I've actually had to write a prescription, but I've probably not done it off the shelf, really. And I've not been able to make a connection to people, because a lot of the stuff we've bought, we've prescribed for people, said, look, at that time, this is what we assess, this is what you need. And then they carry on using it, or they'll go online and purchase it again and again. But your skin will probably have changed, and that might not be the right option for you at that time. So with this range, it covers every base without being too... It's
a tailor-made,
isn't it? Overwhelming. Pardon?
It's a tailor-made.
It is, package. But it's not overwhelming. So I think with some of the skincare ranges we've had, there's that many things, it's hard to make the right choices. With this, it's not as hard to make the right choice, because it's a program, and it'll cover every single skin problem that you've got, really. And then if we need to go more aggressive, then we can do, but we'll do that in clinic, and then we'll send you home
and it doesn't
softer.
Sorry, I'm interrupting again.
No,
it doesn't overwhelm you as a patient either, because we're not going to say, oh, here is 42 products on a shelf that we think you need to have. There's about 12 products in the range. So you literally need maybe 2 or 3 at a time. So, you know, we're not going to send you away with a bag full of products that you don't know what to do with them either. You know, so...
No, I think as well, just to kind of back up from where we are as a clinic, and also to reiterate what Jan was saying with regards to why we've taken on the skincare range. So obviously, Blemish Clinic has got a very strong dermatology background, and certainly one of the areas that they have developed and are going to continue developing is on that skincare side and caring for the skin. And we all know as ladies that our skin is very important to us, and you know, it can change the way we feel dependent on how our skin looks, a bit like how, you know, if our hair doesn't look good, it does affect us. So we have spent some time looking at different medical ranges, and the difference between a medical range and an over-the-counter range is the percentage of active ingredients that are in the products. And it's these active ingredients that will actually work with your skin to obviously get it in the best condition. So what you can buy in clinic and what you can use at home will have a different, higher percentage of active ingredients that's going to benefit your skin. So this particular range you won't be able to go and buy in, you know, Selfridges or Boots or anywhere else, because it does have to be prescribed within a clinic. Okay, so this is where Jan and Kate are working very closely together so that they can analyse your skin, recommend the best products for you, and then you can take the home care away, and you would use those products either in combination with some of your current skincare products, or you would use them instead of. It really depends what you're using, what condition your skin is in, and what we're looking to achieve. So when they're talking about the regime, it's very much about cherry picking what is right for your skin and then working with other ingredients to get your skin in its optimum health.
Yeah, exactly. And the other thing is about penetration as well. So if you look at any skincare and molecules, molecules are of different sizes, so penetration's different with different molecules, as it were. So people never understand that they need to put the lightest thing on first and then build it up. And we always kind of label it number 1, number 2, number 3, AM or PM. So certainly with the retinol, you would start, well, there's some people they could use the lowest percentage every day, but there's some people that we would have to say, right, we'll start off with 3 times a week, and then we'll graduate the application up. We'll step it up. If it causes an irritation, we step it down. And then we'll put you onto another percentage. Retinols stimulate collagen, and obviously those are, the process in the skin will change it to a retinoic acid, which is as good as tretinoin. Tretinoin is a different molecule, well, it's the same molecule, but it goes through a different process. It goes on as retinoic acid, and that's tretinoin, which is very, very aggressive. And a lot of, when you go to the NHS and they prescribe you retinol, tretinoin, it makes your skin peel and it makes it very, very sore and dry. So if nobody goes through any skincare with you, say for instance, if you're suffering with acne, you then get this erythema, and then the compliance drops immediately because people can't cope with the aftermath of the skincare. But this process is slower. But it doesn't mean we're not going to get to the same endpoint. We're just going to do it differently. And it's the same if you had a peel, and Amanda is introducing some new peels into our clinic. They've got different types of absorption. So when you mix them all together, you'll get each layer of the skin. And when we use something called phenol, and it goes really down into the reticular dermis, you'll get each level, the glycolic that will retexturize the surface. But when you get quite deep down, then you'll get the collagen stimulation, because that will make the changes in the plumpness of the skin. So to actually get anything into the skin, you've got to take a bit of the surface off the top to get the penetration. So that's why we want you to do more home care, really. So in clinic, we do a lot of Rejuva pen. So we'll use microneedling, but we use it, rather than rollering it, we will touch the skin and we'll go to different depths. And that's great for, say, under the eyes, for stimulating collagen, but it's also a really good means of getting a growth factor or a regenerative, like PRP, into the skin. But when you go home, it's also good to do some work at home. So we'll have these home care little derma roller kits where you can do that yourself, which is, they're quite, I think they're about 0.25 millimeters, so they're not too aggressive. But if you do that first, then you put your skincare on, or you put a certain skincare on, then roller it in, you're then going to get maximum penetration, so you're going to get the benefits, and you're going to get the mechanism of getting that molecule into your skin to get better results in the long term without it being too aggressive. And one of the other things they've just brought out, and we just bought this, it's called Newer. So this is radio frequency, and I mean, loads of people will have heard about radio frequency for tightening your skin. Well, this is a home-based kit as well. So I've just put something like an activation gel on it. And so you do different sections of your neck. It should do it in a minute. Just bear with me. There. So you press, and then it kind of lifts. Can you hear it?
radio frequency is such a great treatment.
Yeah, can you hear that? Because I'm actually using it. So you do this at home, and all on the, I can feel the heat going into my skin. The more you do it, so it does hurt. So I put it on level 2, which is the maximum.
You're not selling that, Jan.
But actually, you can lower it, so you can start off low and then go higher. But it doesn't cause any problem, but it's just the heat. But you can actually feel the skin contracting underneath your skin, and you will get an immediate lifting effect on this. So, and I think these are on offer, and I think the 250 today, I think they're normally about 350. So you've got this
they are.
thing, and I mean, radiant frequency is huge, and I've had it done before. You can pay £1,000 for something, and I haven't paid for it, but I've had treatment in the past on my neck and on my jawline, and I did immediately see a slight difference. But you do it regularly, and then you'll get the results and the collagenesis over time. So you do get improvement in the structure of the skin and the tightening of the skin. So working with that and your skincare, I think that's the way forward. So you'll come in clinic every so often to have something a little bit more invasive, go away and do these little things at home, and then probably get maximum results going forward. And then each time as seasons change, you know, the central heating, everything affects you. But I'm going to get one of these. Well, we've just bought this, so to use at home, because I think this is really good. And you know, we've got face lights. So I mean, I know Val was in one of my studies looking at face light for rosacea, and you saw a significant improvement, didn't you, Val? You're on mute. Unmute yourself.
Yeah, there we go. It was amazing. It really reduced. I have a real problem with my nose because I had a lot of sun ray treatment when I was younger for acne. I've got a really red. I've got a really red nose, and Jan sorted it out. Unfortunately, about 10 months ago, I got erysipelas on my face caused by strep.
Just explain what that is, so people.
It's just. It's an infection caused by streptococcus, and it causes cellulitis, and it started off with a real strange spot here, and within 24 hours my whole nose was bulbous red and huge, and then it was all under my eyes. And of course I knew exactly what it was and phoned the doctor and said, I want such and such. I did get the prescription, but what it's left me with is my nose is still very red. So I keep saying to Jan, I will have to come back and have some more red treatment and some more laser treatment. But I do have this red light mask, and I do use it.
Yeah. Can I just put in there, Val?
It's all red now.
Hmm?
So,
your nose doesn't look red.
It will be in a bit because I'm having a drink. And I don't drink very much, but I'm one of these people that I just flush up the minute I have alcohol. But I've just got a little bit of makeup on, so it's not too bad. But
you
normally,
know the good thing about, oh sorry.
Well, normally my nose is very red.
It looks great now.
It does look very good.
Yeah.
We do have, the good thing about this as well, we do have a protocol for the IPL laser. And I know there's a few of you on here now that have either have it or they've had the treatment with us. So we do incorporate these products in with your IPL laser, so you can have your treatment, go home and use your products as well. So you know, you're not just coming in clinic for a laser treatment, you know, you're going home and also treating it at home with them as well. So
can I just ask why can't you use retinol when you're having IPL?
No, you could use a small percentage of it, just makes you more sensitive, that's all. I think with the low percentage, if your skin's used to it and you're not having any inflammatory changes, I think that would be fine. But if you were having a high percentage retinol and you had a surface irritation, then it would be, it would
right, all right,
inflammatory response, and it really is only that. But with the combination of these products, you're kind of using a lot of hydration. You've got the stem cells, which with the growth factors certainly it good under the eyes and everything. These kind of things you can use under the eyes. These have been tested under the eyes, and obviously these are going to lift and tighten. And if you're using really good skincare as well, you're going to get maximum results. To be fair,
how long does it take at home to use one of those on yourself?
Well,
and how often would you use it?
They're kind of suggesting, I'm just looking here, they're telling
you want to about the radio frequency?
Yeah, 10 minutes at each section. Yeah, about 10 minutes on. So you kind of individual sections all over your face.
Right.
You can feel, most definitely can feel the heat. They've also, by the way, as well, they've got really good SPF as well, and this. I'm going to try this. That's pigmentation one, but they've got a good SPF in this range, which is 30 plus. This company also does HelioCare, and I've become extremely photosensitive, so they've also got 100 SPF, so you don't get. Yeah, and that's for AK, so that's more of an advanced sun protection.
Does that not leave your skin white when you put it on?
No, none of those things do that. They're all the fluids, so they're not like thick protections. They're all mineral, so it's very different when they're a mineral. This is what I use if I go away. These are antioxidants, so these prevent you from getting photosensitivity when you go in the sun. So when you get prickly heat, before I go away, I take this to help prevent me from getting sensitivity in the sun. So this will stop your skin from erupting and get light eruption, that kind of thing, which people get. I mean, there's a lot of people who are sensitive. You can carry on. I'm going to get some more wine with Katie. You carry on and I'll be back in a minute. No, fine.
I was just going to say to Sally, obviously, because you have a treatment with us in the clinic, and obviously you can't use certain products when you've had your treatment. But as I was saying before, some of these products are tailor-made for the treatment that you're going to have. So if you wanted to use, say, a retinol, we can get you a retinol that's going to incorporate with your treatment.
Yeah, so you're carrying on.
Yeah. So you're not having a skincare range and using, say, a retinol that you bought and you can't use it now because you've had a certain treatment. That doesn't happen with this. So it's all so we have protocols, like I said, for like IPL. So you can incorporate a certain amount of products into that treatment so that you can buy them and take them home with you and use them and carry on your own skincare routine at home and even more, and improve your skin even more than you are doing with having a treatment in clinic. So that's just I think that's a really good thing.
Am I able to go? I want you to bear with me, guys, because I just want to try and share a screen with you so I can show you some of the before and after results. So I'm not very familiar with it, but I'm going to learn how to be very good with it, because obviously this is something I've never done, only in the last 6 months. So just bear with me, because I'm going to share this screen. Can you see it?
No.
No. Okay, just bear with me and I'll go back to my Zoom, and I'm going to have to go.
Can I just ask, do you need to sign up? Do you like pay a monthly amount, or do you just buy as and when you need things?
No, so if you want to buy products from ourselves through our clinic, you can register through the ALLSKIN MED site as a patient and buy your own products online, so you have to come into clinic for them. So say you bought some products from us and that we said to you, oh, you need this, this and this, you go home, use them, run out, You don't have to come back in clinic for it. You can just go online, put, I'm not, is it, Amanda, is it like a patient PIN or is it a password or just an account they have to make?
Yeah. No, so it's a link that we would share with you, and then you've got the choice. So you can either buy the products from the clinic, okay, or if you obviously are aware of what's been recommended to you, then you can go into the portal and you can buy them yourself. So what that does is, if you need to obviously buy something on repeat, then you actually don't need to go to the effort of coming into the clinic. It is available to you through this online portal.